Former President John Mahama there. Let's return to our earlier story where the FDA is warning about the use of dexamethasone, which British medical scientists is hailing as a good drug for the treatment of Covid-19. We're joined on the phone by Sabblah. He's the head of safety monitoring of the FDA. Thank you very much, sir, for your time here on NewsDesk. You're saying that we shouldn't use this because it has side effects. What exactly are these? Are the effects of using dexamethasone without prescription?
Good morning, and good morning to your listeners. What the FDA is not saying dexamethasone is a bad drug, but we are just trying to caution the general public that abuse of dexamethasone can be dangerous. First of all, let me start by saying that
then we break for business.
We all agree that COVID-19 is a new disease, and all over the world, scientists are fighting and working around the clock to find effective treatment or prevention for this disease. And this includes use of older medicines, and dexamethasone happens to be one of them. And secondly, dexamethasone has been around for decades, since the 1960s, and it's been used for a number of conditions, including asthma, arthritis, and so many other conditions. So, and dexamethasone belongs to a family of drugs called corticosteroids. And these drugs work by suppressing excessive immune reaction and by reducing inflammation. And dexamethasone's use in COVID-19 is because in COVID-19, and patients, in particular patients who are critically ill and requiring oxygen or ventilators, the immune system goes into overdrive. And the immune system is designed by God to protect us against disease. So in case you are infected by a bacteria or a virus, the immune system works in such a way that it fights the bacteria or the virus. But in COVID-19, in the process of fighting the disease, the immune system goes into overdrive. So the reaction becomes excessive. So dexamethasone works by suppressing the immune system. So that's what dexamethasone does. And like I told you earlier on, that dexamethasone belongs to a group of drugs called corticosteroids. So there are several other drugs in the same family. So what the FDA is saying is that dexamethasone is not to be used for prevention or treatment of COVID-19 by patients at home. What is happening is that in the British study, the study found out that dexamethasone is able to reduce death in patients who are on ventilators and who needs oxygen. So what it means is that it's not every patient who need dexamethasone.
Definitely.
So that's what we should do.
And I'm just wondering, because of what appears to be a rush by Ghanaians to get this drug, like we saw with chloroquine and with the vitamin C when it came up as part of the treatment for COVID-19, is the FDA doing anything to check the purchase of the drug on the market, over the counter? Is there anything you can do if you're not doing anything already?
Yeah, so the press release by the FDA is the first step. So we are informing the general public that this drug is already available, and it's a prescription drug that is used for the condition that I've already stated earlier. And it's a prescription-only medicine, so you can only buy it when you have a valid prescription for a licensed medical practitioner. You don't go and buy it over the counter. And if you look at the FDA statement, I told you earlier that dexamethasone belongs to a family of drugs. So there are other drugs that are used for people who are on ventilators and who are infected with COVID-19. So the drug is available in this country for treatment of patients who need ventilators and who are on oxygen.
Okay.
So the drug only prevents death in patients who are on ventilators and oxygen, and not moderately ill or patients who are asymptomatic.
Very well. Mr. Sabblah, thank you very much for your time here on NewsDesk. I guess this has gone out well to all who are watching. You don't have to get dexamethasone if you're not on treatment. In fact, it is a prescription drug medicine, and you should be careful because it reduces the immune system as well, especially if you're not infected with COVID-19. Now, we're taking a break here on NewsDesk. When we return, we'll hear from the coalition of people affected by the banking collapse, while expressing disappointment with government's handling of the that situation so far. Stay with us.